Ellie Fund has provided support services to patients with cancer since 1993. Recently, however, the nonprofit recognized a need to connect with patients other than those referred by large hospitals.
Typically, underserved men and women, maybe they're being diagnosed at a community health center, or maybe they found a lump and were too afraid to tell anybody at their GP's office. You know, we have patients that are choosing between food and treatment, or choosing not to treat at all because it's too hard to get there.
The Ellie Fund began working directly with community health centers, including the Dimmock Center in Roxbury. For 160 years, this urban health hub has cared for the people of Boston and provides more than 19,000 people with medical care every year. Dr. Charles Anderson is the president and CEO.
My boss is the community because 51% of my board are community members and people who receive services at the health center. So we provide a broad variety of services: dental, eye, primary care, OB, pediatrics. Really, that's part of our mission, to make sure we're providing the types of services that the community requires.
There have been significant advances in breast cancer research in recent years, but there are still gaps when it comes to equitable pathways to treatment for women of color.
No one decides that they don't want to be screened. No one decides that they don't want to take many of those preventive measures. But when you have so many other things that you're trying to juggle, which have so much more immediacy, some of those things it's harder for them to take the same level of priority.
Breast cancer is the second leading cause of cancer death in American women, but Black women are 40% more likely to die from breast cancer than white women.
We treat at least 2,000 new breast cancer patients a year.
Dr. Beverly Moy says Black women in Boston are getting their annual screenings, but once diagnosed with cancer, some face barriers to quality care.
It could be the financial burdens of dealing with a cancer diagnosis, missed work. You know, you might have children. You know, there are a lot of competing issues when you're a woman and you're diagnosed with this cancer experience. And a cancer diagnosis is one of the most common reasons why people go into bankruptcy in the United States. And the fact is, if you're in the United States and you're Black and diagnosed with breast cancer, you have almost twice the risk of dying as if you're compared to you're white.
I think we have a moral obligation to make sure everyone has a similar opportunity for a health and wellness outcome. There's no reason why, just because of the circumstances someone's born in, that their ability to live a long life is so different.
For Dr. Anderson at the Dimmock Center, understanding where a person is from and what they are going through is a critical component of practicing medicine.
We just have to teach providers and anyone involved in healthcare to be better listeners. That's really what compassion to me is really about, which is really the cornerstone of healthcare.
Hi, how are you?
And the Dimmock Center is already working towards making their patients feel at ease.
Seeing providers that look like you, look like our community, is really, really important. And not just doctors, front desk staff. There are people who come in and receive services and they're seeing a neighbor. And that's a really critical part of who we are.
Helping other breast cancer patients feel at ease is part of Nakia Clark's outreach mission at the Ellie Fund. After all, she's a survivor herself.
If they have someone that looks like them that tells them, hey, if you're afraid, I'll go with you, I'll talk to them. I have people who can help you. They'll be more willing to go out and get that examination, get that mammogram, speak to their doctor when they feel like there's something that's wrong.
A ride to treatment, childcare, those grocery gift cards.
It is not right to ask a patient to take 3 buses and a train to get to radiation for 18 to 30 radiation treatments, and that's the situation that they're facing. We also work with a lot of women that have school-age children, and we're very fortunate that we're able to support up to 50% of their child care costs.
Ellie Fund's been a really important partner in ours of really making sure that we're getting people access to that type of care coordination and navigation, which is really the critical part.
You know, all the doctors we spoke with said that language barriers remain a major hurdle to access to medical care.
Yeah, and those are barriers that they're working to break down because, of course, communication is key for follow-up appointments, proper treatment, all of that. Still to